hand-eye coordination, a very small cavity, the intricate anatomy. Actually, these are exactly the same things which makes ENT difficult for an MBBS student.
प्रॉब्लम ENT के साथ ये है कि otology, rhinology, larynx, head and neck all are so intricate and they are all, seen to the surgeon, not to the people.
Why do you do this? Like every lecture of yours, what I've seen, it starts with a monologue. Why to first talk and then to teach rather than teach and then talk? Why? What's unique about that?
Actually, अगर कोई पेशेंट हमारे सामने आएगा तो वो कैसा दिखेगा, वो बच्चा कैसा होगा, तो अगर एक स्टोरी आपको मैं बताऊंगा तो आप हमेशा वो स्टोरी याद रखोगे, not the text that I tell you.
Hello guys, welcome back to PW Med YouTube channel once again. It took 2.5 years to get the person who's with me on this dais. And I think it's worth it. So two things which fascinates me about Dr. Sanchit here is one, he teaches the subject which I like a lot because I had got amazing ENT professors. The intricacies of ear, the petrous bone, everything is actually fascinating to learn and understand. Second is art of storytelling. So I always feel that when you connect more with a real life, that's what Dr. Sanchit does in lectures. And that is the best way to learn for me, medicine, pathology, ENT or any subject for that matter. So I have a list of questions which the team has given me to ask Sanchit, but I'm going to make it very, very informal and you're going to talk from the heart. So welcome Dr. Sanchit first of all to the podcast and welcome to PW Med.
Thank you so much, Dr. Ranjith. First of all, I've been a fan of your pathology classes.
Thank you.
And I'm so glad to be with PW Med as an ENT faculty. And I'm really looking forward for a very exciting journey ahead.
Great. So first question is like, why ENT?
Okay, that's something very tricky. So I actually never knew what God has in store for me. I finished my MBBS, post-MBBS. When I finished my internship, till then, I never knew what subject I should choose, very frankly telling. But the thing was that I wanted a surgical field. That was pretty sure in my head that I have to go towards the surgical branch because I was fascinated with surgeons. I used to see them coming out of the OT, people running behind them. So I was like fascinated, like these people, grab some attention, they do some work, adrenaline rush. So I knew I wanted to be a surgeon, but what I should choose, I never knew. ENT came to me as a post-internship. I did a fellowship in critical care medicine. And there I got to know a person who was doing ENT surgeries parallelly. So during that time, I used to see him that he is, operating inside the nose and he is seeing the screen with an endoscope. He is going into a very small space, doing a very intricate surgery, and suddenly the person starts to hear. I saw a small boy, he doesn't hear since birth, and suddenly, after 7 days of the operation, he starts to hear by implanting a device inside. So these things fascinated me. Also, I was a great, the game player. Like I used to play video games a lot. So the thing was that what I felt that ENT has got a lot of connection with video game stuff.
Okay.
That is just like playing a video game on screen. You see the screen, you do the stuff from here. It's like playing FIFA. So it's the same way the surgery is. You're seeing the screen, you're doing stuff over on the patient. So that hand-eye coordination, intricate anatomy. I was really interested in head and neck, especially. And that gave me a path into ENT. And post going into ENT, I further decided that I'm really interested in the oncological aspect. So I super specialize in that aspect later.
So it's actually fascinating to see someone who actually compares the real life video game aspect to the subject. I think most of our students will love to listen that whatever they've been doing for hours, it's not wasted. They can go and tell the parents that, see, I'm playing video game maybe to become like Dr. Sanchit in future. The things what you said, the hand-eye coordination, a very small cavity, the intricate anatomy, actually these are exactly the same things which makes ENT difficult for an MBBS student.
Absolutely.
Because when I was an MBBS student, I don't get to see that. I don't sit in the operating microscope. I cannot maneuver to the Force of Rosenmüller. I read them. I am not able to relate. So how do you think you can make a fresh student who is entering third prof, who is full of energy, but there's no screen in front of me? How to make them visualize what can you do for them to make them have the same interest like you in ENT?
So it's a great question, Dr. Ranjith, because मुझे ये लगता है the moment ENT में कोई भी बच्चा आता है, that is in third year, and उनको हम OT लेके जाते हैं, तो suddenly क्या होता है, the interest जाता चला जाता है, and they keep going on the side of the OT theater और वहाँ पे बैठ के रील बनाने लगते हैं कि we are there inside the OT. पर उनको कुछ समझ में नहीं आता. एंड इवन इफ यू शो देम कि ये देखो ये इंकस दिख रही है, ये मास्टॉइड है, दे हैव नो ओरिएंटेशन. क्योंकि प्रॉब्लम ईएनटी के साथ ये है कि ओटोलॉजी, राइनोलॉजी, लैरिंक्स, हेड एंड नेक ऑल आर सो इंट्रिकेट एंड दे आर ऑल seen to the surgeon, not to the people.
True.
Like because we are under the microscope, so surgeon को दिख रहा होगा, पर वो दूर से he cannot explain कि देख के ये बताओ कि ये क्या है. Like you can grossly see general surgery, orthopedics, they can grossly show you structures. But I think ENT and ophthalm are two subjects जिसमें आप नहीं समझ पाते हो कि क्या ओरिएंटेशन है. Because आप पढ़ते anatomy in one segment हो, एक dimension में, operate आप किसी और dimension में करते हो. So suppose आप यहाँ middle ear सीधे पढ़ते हो and when you do the surgery of middle ear, you are lying down and you have to create some kind of a 3D visualization कि ये कहाँ पे है, वो कहाँ पे है. So people generally go off fading away in interest by the end of the year. So that is one of the reasons also people don't take ENT as a first preference branch. क्योंकि उनको लगता है कि हमें जो anatomy समझ ही नहीं आती, उसमें हम वो काम कर ही नहीं सकते.
True.
But the thing about ENT, the most fascinating thing I would say is कि जैसे ही आप इस subject में आते हो, the most important thing is to reveal and get adjusted to the anatomy in every dimension. ऊपर से कैसा दिखता है, साइड से कैसा दिखता है, सामने से कैसा दिखता है. So even in the lectures I take and जो भी theory and practical I teach, I show them diagrammatically कि पहले visualize करना सीखो, at least reveal the structures out कि साइड से जब हम ऑपरेट करेंगे तो कैसे होंगे, सामने से स्कैन पढ़ेंगे तो कैसा होगा. And उसके हिसाब से if you get interested into the anatomy well, like if you grab the anatomy well, pathologies are not at all going to be a difficult task of difficulty. Because pathologies में हर चीज predictable हो जाती है. ENT में सिर्फ 4 और 5 symptom ही है जिसमें every particular disease is revolving around. So it becomes very easy if you know the anatomy well. True. So that is why they have to be some amount of hours dedicated कि आप पढ़ो. Don't go retrograde because that is a failure. So don't read the pathologies and then you're going back to the anatomy because you never understood about it.
Maybe not to start from the PYQ of Bell's palsy, maybe understand facial nerve.
Absolutely. Because if you don't know the facial nerve course, Bell's palsy becomes a thing which you mug up.
True.
And then next day that becomes something else.
True.
So that is something that I think we can, we always have a plan about. जब भी हम पढ़ाते हैं बच्चों को, सबसे पहले we give a lot of time on foundations and basics कि अगर उनको एक बार structure समझ में आ गया, then hardly we save a lot of time pathologies में जब जाते हैं.
Great. Great, Sanchit. Like, maybe आपके lectures देखेंगे. Like, one important aspect is storytelling. You start with the monologue. You start with talking. You don't start with the board. You don't start with the point, right? So, how important you think, and why do you do this? Like every lecture of yours, what I've seen, it starts with the monologue. Why to first talk and then to teach, rather than teach and then talk? Why? What's unique about that?
So, brain is a funny organ. So the thing is कि whenever you attend a lecture, the first and foremost thing should be कि बच्चे के अंदर एक visualization आना चाहिए about एक patient है, वो एक clinic में आ रहा है and उसको ये particular disease है, तो वो अंदर आते ही वो कैसा दिखेगा, उसमें क्या symptom दिखेंगे, क्या signs एक डॉक्टर नोट करेगा. तो सडनली सपोज एग्जाम्पल के तौर पे हम एक एडेनोइड हाइपरट्रॉफी पढ़ते हैं. तो एडेनोइड में बहुत सारी चीजें हैं, एडेनोइड फेशिस है, हम पढ़ते हैं, ओटाइटिस मीडिया विद फ्यूजन है, तो बहुत सारी चीजें हैं. बट हम लोग क्या करते हैं, इनको पढ़ के रट लेते हैं एंड वी से कि ठीक है एडेनोइड फेशिस लुक लाइक दिस. तो बट वी नेवर विजुअलाइज इट. हमें कभी नहीं समझ में आता दैट एक्चुअली अगर कोई पेशेंट हमारे सामने आएगा तो वो कैसा दिखेगा, वो बच्चा कैसा होगा. तो अगर एक स्टोरी आपको मैं बताऊंगा तो आप हमेशा वो स्टोरी याद रखोगे, नॉट द टेक्स्ट दैट आई टेल यू. इट इज एज सिंपल. तो अगर मैं आपको एक रिलेट करके स्टोरी बता सकता हूँ कि बच्चा आ रहा है, स्कूल में अच्छा नहीं कर रहा, वो बैठा, द पेरेंट्स आर कंसर्न्ड, दे आर थिंकिंग कि इस बच्चे को अटेंशन डेफिसिट है, बट एक्चुअली वो हियर नहीं कर रहा, तो दैट स्टोरी समहाउ कम्स अप इन द स्टूडेंट्स माइंड कि हाँ ऐसा कुछ होगा. सो द मोमेंट दे कम इनटू क्लिनिक्स, द सेम स्टोरी गोज इनसाइड देम व्हेन दे सी द पेशेंट. ट्रू. एंड दैट मैचेस अप. Great. So our teacher used to teach us like that. We got very fancied with that concept. कि हमें लगता था कि हाँ ठीक है, ये स्टोरी हमें हमेशा याद रहेगी. वॉइस अगर वो निकाल के दिखाते थे कि होर्सनेस है तो कैसी वॉइस आएगी, तो वो हमें जिंदगी भर याद रहता था कि होर्सनेस ऐसी होती है, हॉट पोटैटो वॉइस ऐसी होती है. So it becomes very interesting to capture the subject.
So I hope you have done some mimicry also in the,
I do a lot of mimicry. I create faces. I do a lot of voice changes.
Great.
Just so that the patients can understand ki what is the logic behind that symptom.
Amazing. So we just diverted a little bit to non-academics of you did make some funny voices and funny faces. I also heard that you play multiple instruments. Is that true? And why I'm leading to this is like, in this generation, students feel that they have been overburdened. So what advice you want to give them? Like, everything needs a balance. You might be a topper, you need a balance. You might be an average student, you still need a balance. What is your advice for every student who has entered the third year, and when they go to final year, this batch is going to face like 8 major subjects or 9 major subjects totally put together. So what is required for them to have a balance so that they don't get burnt out when the exam comes? At the same time, the journey also becomes very smooth. And maybe if possible, you can do some mimicry as well.
So the thing is that before doctors, we are human beings.
True.
We also need a life. It's just not about reading subjects and 19 subjects, because हम लोग क्या करते हैं? We make it too important for ourselves right from the beginning of first year कि हमें 19 subject पढ़ने हैं, 19 subject पढ़े, NEET PG निकालना है और FMGE निकालना है, then going into further, then super specialized. We just catch the train.
True.
और वो चलती रहती है. And we never care about ourselves, our hobbies, our interests. और बच्चे के बहुत सारे interest होते हैं. Like, okay, reading is an important part of our life. We are doctors, we should know about things. But at the same time, we should have something to go home to.
True.
हमारे पास, we should spend time with our family, we should have time for our own selves, for our own self-growth. Because I've seen children जो जिंदगी भर बस पढ़ते रहते हैं. And by the time you ask them कि बेटा, you know, like, what are your hobbies? So they tend to tell कि नहीं सर, मैं तो कुछ, I have no hobbies. या सब कभी कहते हैं sleeping. So sleeping is not a hobby. So hobbies are something which is very important to inculcate right from beginning. आप first year से वो करो. और कुछ बच्चे painter होते हैं, कुछ बच्चे dancers होते हैं, कुछ बच्चे singers होते हैं. So मेरा personal interest was in singing.
Okay.
So I happened to learn Indian classical music.
2 lines?
No, please, not now. But I happen to do that whenever I am, in my own space. I'm tired with the work that I'm doing in the whole day. That gives me a lot of pleasure outside work, because it takes me away from what my regular life is.
Great.
So that is something you should not leave out on. And अगर आप अपनी हॉबी को अपने इसके साथ रखते हो, तो मुझे लगता है कि इस पर्टिकुलर जर्नी में there is a lot of importance, because these hobbies give you a lot of confidence.
True.
They inculcate a good, you become a good orator. When you have a good hobby, you become a good orator. You become a good, balanced person. So it's very important to keep hobbies. Don't miss out on that. And at least you should give 2 घंटे खुद के लिए.
Perfect. Amazing. So students, we have heard a little bit about Dr. Sanchit's journey of ENT, why ENT, and how ENT can fascinate him. I think he will be able to translate the same amount of interest, if not more, to you guys as well. So we'll be listening more. You guys will be listening more about the lectures of ENT with Dr. Sanchit, live recorded whenever it is. And don't forget to put in the comment section what song you want him to sing in the lecture, so that he'll get prepared. See you soon, Dr. Sanchit. It's an amazing pleasure to meet with you, and hopefully we'll make the journey of the student not a pressure journey. Let's make it equally balanced and a pleasurable journey to learn and excel in medicine.
So I always say, let's make your journey more entertaining with the ENT in that.
Okay, so it will be entertaining, and please don't forget to put in the comment section what song he wants to sing for you guys. Thank you guys. See you soon. Bye-bye.
Thank you.